Innovation has been a big part of American history, and a big part of innovation in American history has been medical and technology advancements. Medical technology has been a part of the world since the dawn of civilization, and it's been used in many ways. Ways that would not be considered technology probably today because it seems somewhat primitive, but it was still technology back then. Medical technology can save lives, and it brings us knowledge because doctors have different tools they can use to help better care for patients and diagnose people, and they have vast amounts of knowledge through databases and different technology that they can learn about their diseases and just care for people better. The heart, before the 1900s, the heart was not really looked at because people had died earlier from many different diseases. But at the turn of the 19th century, or at the turn of the 20th century, the heart became a big deal because people were finally living to an age where heart mattered, and heart disease is now one of the leading causes of death in the United States. And the heart is very delicate. It's not something that can just be messed around with, and it takes a lot of care to treat it. The electrocardiogram dealt with the heart. It was created in 1909. It allowed doctors to measure cardiac rhythms. It led to the diagnosis of new diseases and allowed them to treat ones that they knew of, and it allowed them to just better understand the heart overall. The heart and lung machine, created in 1935 by Dr. John Gibbons, was an idea to bypass the heart during surgery so that it could be operated on, because before this, the heart, anytime it had to be operated on, was through open heart surgery while the heart was still beating. Now, doctors could not operate on a beating heart because that was incredibly difficult, and many of the patients did not survive. He first tested his idea on a cat, and it was successful, and the bypass lasted about 30 minutes. And then almost 20 years later, he was allowed to do this on a human patient. It is still used today for big surgeries, and they basically use this machine to bypass the heart. It takes the blood out of the body, oxygenates it in a machine, and then pumps it back into the body, completely bypassing the heart so that doctors can work on it without damaging it further. The pacemaker, which was created in 1952, was a massive innovation because it allowed people with heart abnormalities to be able to take care of themselves better. And at first it was very impractical because it was the size of a small TV and patients would have to cart it around. But then through later innovation, and even today, we have pacemakers that are very small and tiny, and they can last many years, and it allows patients with abnormalities in their heart to live their daily lives like normal and not think twice about it. The Jarvik 7, which was created in 1982, which is similar to the heart and lung machine. It's actually an artificial heart. It does the same thing, as in it's a machine that oxygenates blood, but it does exactly what the heart does, and it pumps blood through one chamber out the other and oxygenates it. It is meant to stay in the body, and it's meant to be permanent. It can last up to a year, and doctors use it when they're bridging the gap between a transplant, usually today, where a patient will come in and they have a very weak heart that is basically not useful anymore. They can put in this artificial heart, which can last up to a year for a pretty long time until patients can actually get a heart transplant. The Da Vinci robot surgical system, which was created in 1999. It's a very precise system that allows doctors to do many surgical maneuvers and techniques that they wouldn't normally be able to do. It's got many surgical operations like computed into it. The surgeon still controls the system, but it allows them to be more precise and more accurate, which saves many lives. This allows for laparoscopic surgery, which is less invasive, which allows the doctors to have a better outcome, and the patients will not have as many fatalities and won't have any complications from surgery because it's nowhere near as harmful to the body as open, like chest surgery is. And the lasting effect of medical technology is that it can help to drive change, and this can create new tech, which can lead to new jobs, and the people will come to create new tech to help better treat people. It can solve small problems or large problems, such as someone who has a heart arrhythmia and needs a pacemaker. They could get one and then live their daily lives, or it could even be someone who needs laparoscopic surgery from a Da Vinci system, which a doctor could do, which has less bad outcomes. Or it could be anything from a artificial heart that a patient might need a heart transplant from. It affects all parts of life, and medical technology will never cease to exist. It will always be changing,